Hi, my name is Mike Enck. I'm a territory manager in Tennessee, and due to some audio difficulties we had recording this video, I had to come back and do some audio dubbing, so my apologies for the presentation. This is Natalie Limley. She is with Vanderbilt Children's Hospital. What we're talking about now is just the preparation of the simulator. There you see the directions for use that we talk about, how that will show and explain, how to fill the baby, how you will use each piece that comes with the baby. We're talking now about making sure you put the cap on, so you'll have fontanelles for proper identification of presentation of the baby when you are or during your simulation. As you can see, it's a pretty easy simulator to use. It's basically kind of straps on like a reverse backpack. What we're showing here is this is the blood reservoir that we are uncapping. That will allow you to fill with simulated blood to show a postpartum hemorrhage if you so choose to during your simulation. This is the area where you can fill with your penguin aspirator to inflate, to give you the sense of a fundus or fundus massage. See there, I'm actually inflating with the penguin aspirator. So now that's actually inflated, so you can actually feel, and it will then translate through the outside of the simulator to feel for your fundus exam. She has a little hook there that kind of hooks back up over the black knob that we opened for the blood reservoir, and I'm actually showing there's the placenta, and what I'm actually taking off is the actual retained portion, which you can put in first if you'd like, and then overlay the placenta over, and then you have the umbilical cord coming off of that onto the baby and attaches, so you can actually simulate a retained placenta during the simulation if you choose as well. So what we were talking about here is actually the time where you come to load the baby and kind of presentation. So the flexibility of the baby mannequin gives you lots of opportunity to simulate different difficult deliveries if you so choose. So Mary Lee is now loading the simulator. Then you have a snap that kind of snaps once you have the baby positioned where you'd like. And then you just kind of cover there. And what she's doing with her hands, or what I'm doing now, is I'm showing actually where you would go with what we're using is water. You could use simulated urine to actually fill. There's a little bladder right underneath to fill to simulate if you want to actually do urine catheterization, because the unit comes with a catheter to enable you to do so. And that's important in the simulation because that can actually kind of change the position of the baby. What I showed you, the green thing, was what actually you could actually squeak for delivery of the baby to simulate the crying. This device actually attaches to the baby to give you umbilical pulse, and then you also have the device to actually hear fetal heart tones, which Mary Lee would actually tap on the plastic blood reservoir to simulate that. So if you want to simulate tachy, bradycardia, whatever you want to, normal fetal heart tones, you could just by tapping on that. This is actually a blood drainlet, so if you are going to use the postpartum hemorrhage effect, that gives you a little bit of area to drain into a basin to try to kind of keep things a little bit cleaner. We chose to go gown and just show the perineum, just kind of show the full effect of what this looks like, so you can actually see she looks somewhat pregnant with the simulator there, but you're now simulating the kind of reality of what a real patient would look like with just a gown on. As you can see, I'm not gloved as I should be, but actually going and listening to Mary Lee actually simulate the fetal heart tones now. So you have that ability to examine there. Now we're actually going to just start simulating the delivery, which she is controlling how the baby comes out and how the baby presents based on her hand placement within the actual simulator. Now there's the catheter, which you actually can insert, and it'll actually release the urine from the bladder that we filled earlier while we were doing the setup. And that actually drains in my basin there. So we're just talking about the importance of what that would mean during the delivery. Now we're starting to deliver the baby. As you can see, we still look like we are, with a real patient there, and it's just the matter of the simulator. We're starting to deliver the baby. You see, you can position and turn and feel. Now we have the ability to take off the umbilical cord there and still have that portion there for the next section is when we will deliver the placenta, which she is also controlling how difficult or easy that is based on what kind of simulation we're running. Now what you're seeing is I'm actually, if you remember, we loaded it with the retained portion still in there, so it allows you to actually simulate now retained placenta and the removal of that. And there's the portion coming out there. So at this point you've handed off the baby to, which you could use as your the Natalie as your NRP piece, or you could actually transition even into a sim newbie situation as well too, or a newborn A if for that matter. But the nice thing about this kit is that you can also use the newborn the neonatal as your NRP simulation. So what we're going to show here is we have set up, we have the bottom, we have that blood drainlet, as you can see, into my basin there, and we have the floor kind of covered there. And what we're going to show here is we're going to massage the fundus massage, which remember we blew that up earlier with the penguin aspirator. And so now we're just talking about if you wanted to take it further. I think we're going to go back in here and even we have some more urinary problems or bladder issues we want to do. So we want to do a urinary catheterization. And in doing so, during this time, we chose to have a postpartum hemorrhage there, as you can see. So that what she's actually doing is opening up that valve on that white tray we showed you, or container. That's actually now simulating a postpartum hemorrhage. As you can see, it's a very easy simulator to use. Not only that, but it's very portable. No electronics involved, so it's very easy to take anywhere from a car to an ambulance to a classroom to wherever you so feel. So that'll conclude our demo of the Mom and Natalie today. I appreciate your time and thank you very much.